Now it's time for the Nervous and Endocrine System chapter. Located at the back of the female section is the endocrine section. Systems of the endocrine system include thyroid gland, parathyroid gland, thymus, adrenal gland, pancreas, and carotid body. The thyroid gland, or simply the thyroid, is an endocrine gland in the neck, consisting of two lobes connected by the isthmus. It is found at the front of the neck below the Adam's apple. The thyroid gland secretes thyroid hormones, which primarily influence the metabolic rate and protein synthesis. The hormones also have many other effects, including those on development. Turn to the beginning of the thyroid section. You can find it at the end of the female genital system. Let's look at the excision section. 60100 is for a biopsy of the thyroid through a percutaneous core needle. Notice the parenthetical notes underneath it for imaging guidance and for fine needle aspiration. 60200 is for excision of a cyst or adenoma of the thyroid. 60210 is a partial thyroid lobectomy, unilateral, with or without isthmusectomy. Now, remember, that is a lobectomy. That's a lobe of the thyroid. 60212 is partial thyroid lobectomy, unilateral with contralateral subtotal lobectomy, including isthmusectomy. 60200 is a total thyroid lobectomy, unilateral, so one side, with or without isthmusectomy. Thyroidectomy, total or subtotal for malignancy with limited neck resection. I have a note next to this that says lymph nodes 2. That means they are taking some of the lymph nodes as well when they are performing that procedure. 60254 is with radical neck resection. I have a note next to this that says removal of lymph nodes along with accessory nerves. Now let's look at the parathyroid section. The first code in the excision section is the parathyroidectomy, or exploration of the parathyroids. Parathyroidectomy means removal of glands on the posterior surface of the thyroid. That's the back of the thyroid. You can see a picture of this down here on this illustration. The parathyroid glands are on the back of the thyroid. 60520 is a thymectomy, partial or total. That is an excision of the thymus. 60520 is by the transcervical approach. If the adrenal glands are excised, that will be 60540, adrenalectomy, partial or complete, or exploration of the adrenal gland with or without biopsy. This is by transabdominal, lumbar, or dorsal approach. Notice all of the parenthetical notes under 60545. The laparoscopy section includes all of these procedures, but done laparoscopically. The endocrine system was very short, so this chapter is included with the nervous system. The nervous system is broken down into two parts: the central nervous system, which is the brain and the spinal cord, and the peripheral nervous system, which is the nerves that branch off from the brain and the spine. This is an example of the nervous system. You can see the brain, the cerebellum, the spinal cord, and brachial plexus, and all of your nerves. You have intercostal nerves, which are inside your spine, your subcostal nerves, your lumbar plexus, your sacral plexus, your femoral nerve, sciatic nerve, saphenous nerve, and tibial nerve. You have perineal nerves down here by your tibia and fibula bone, and superficial perineal nerves. There are 4 lobes to your brain: the frontal lobe, peritoneal lobe, the temporal lobe, and the occipital lobe. There should be a diagram of this in your book. Now we're going to look at the nervous system book. I put a note at the top of that page: 4 lobes of the brain: frontal, parietal, temporal, and occipital. The first section of the nervous system is the skull, meninges, and brain. The first thing we're going to look at is the system twist, drill, burr holes, and trephine. Put a note here that a burr hole is a dime-sized opening in the skull. They do this to get access to the brain. 61105 is twist drill hole for subdural or ventricular puncture. 61107 is twist drill holes for subdural, intercerebral, or ventricular puncture for implanting ventricular catheter, pressure recording device, or intracerebral monitoring device. 61120 is burr holes for ventricular puncture. 61140 is burr holes or trephine with biopsy of brain or intracranial lesion. 61150 is with drainage of brain abscess or cyst. 61156 is burr holes with aspiration of hematoma or cyst intracerebral. If they also implanted a catheter reservoir EEG electrode, pressure recording device, or other monitoring device, it's 61210. Now turn to the surgery of skull base section. Let's go over the guidelines. The surgical management of lesions involving the skull base often requires the skills of several surgeons of different surgical specialties working together or in random during an operative session. These operations are usually not staged because of the need for the definitive closure of dura, subcutaneous tissue, and skin to avoid serious infections such as osteomyelitis and meningitis. The procedures are categorized according to 1. the approach, 2. the definitive procedure, and 3. the repair or reconstruction. Let's go over these terms. The approach procedure is described according to the anatomical area involved. For example, anterior cranial fossa, middle cranial fossa, posterior cranial fossa, and brainstem or upper spinal cord. The definitive procedures describes the repair, biopsy, resection, or excision of various lesions of the skull base and, when appropriate, primary closure of the dura, mucous membranes, and skin. The repair procedures are reported separately if extensive dural grafting, cranioplasty, local or regional myocutaneous pedicle flaps, or extensive skin grafts are required. For primary closure, see appropriate codes, for example, 15732, 15756 through 15758. When one surgeon performs the approach procedure, another surgeon performs the definitive procedure, and another surgeon performs the repair or reconstruction procedure, each surgeon reports only the one code for the specific procedure that surgeon performed. Approach procedures. Anterior cranial fossa. Anterior is the method used to get exposure to the lesion. For example, 61580 is craniofacial approach to anterior cranial fossa. Extradural, including lateral rhinotomy, ethmoidectomy, sphenoidectomy, without maxillary or orbital extension. The code 61584 is orbitocranial approach. So remember, you need to make sure you know the approach being used. Was it craniofacial, orbitocranial, bicorneal, infratemporal, post-auricular approach, orbital cranial, zygomatic approach? If it was the posterior cranial fossa, it is coded the same way, by approach. You can make notes next to these codes to easily find the approach you're looking for. Now turn to the neurostimulator's intracranial section. Codes 61850 through 61888 apply to both simple and complex neurostimulators. We'll talk about what a neurostimulator is here in a minute. For initial or subsequent electric analysis and programming of neurostimulators pulse generators, see codes 95970 through 95975 in the medicine section. Microelectrode recording, when performed by the operating surgeon in association with implantation of neurostimulator arrays, is an inclusive service and should not be coded separately. If another individual participates in neurophysiological mapping during a deep brain stimulator implantation procedure, this service may be reported by the second individual with codes 95961 through 95962 in the medicine section. Before we go into these codes, let's talk about what a neurostimulator is. A neurostimulator consists of a battery called the pulse generator, seen in this illustration on this page, and it also includes electrode arrays, sometimes called leads. Placement of a subcortical neurostimulator electrode via a burr hole with connection of the electrode to the implanted programmable pulse generator. The first code, 61850, is twist, drill, or burr holes for implantation of neurostimulator electrodes. Cortical. So in this procedure, they are specifically doing a twist drill or a burr hole to implant the neurostimulator. In 61860, a craniectomy or craniotomy is used to implant the neurostimulator. In 61863 is for a twist or burr hole, craniotomy, or craniectomy with stereotactic implantation of a neurostimulator electrode array in the subcortical site, and it gives examples of those sites, without the use of intraoperative microelectrode recording. First array. The atom code underneath it is for each additional array or electrode. 61867 is the same thing, but with the use of a intraoperative microelectrode recording. So that's important to know. You wouldn't want to choose 61863 if the recording was done. If the neurostimulator was removed or revised, you would use 61880. For a replacement or insertion of a cranial neurostimulator pulse generator receiver, which is the battery, direct or inductive coupling with connection of a single electrode array is 61885. Now let's talk about the spine and spinal cord. The first section, injection, drainage, or aspiration. For radiological supervision and interpretation of an epidural, use 72275. Code 72275 is only to be used when the epidural is performed, images documented, and a formal report is issued. Code 62263 describes a catheter-based treatment involving targeted injections of various substances via an indwelling epidural catheter. Code 62263 includes percutaneous insertion and removal of the catheter. For the administration of multiple injections of a neurologic agent performed during a serial treatment sessions, example spanning 2 or more treatment days, if required, adhesions or scarring may also be lysed by mechanical means. Code 62263 is not reported for each adhesiolysis treatment, but should be reported once to describe the entire series of injections or infusions spanning 2 or more treatment days. The rest of this guideline section gives some good examples of the codes. You should read over those when coding these procedures. Let's go over some of the common ones. First, we have 62270, which is a spinal puncture lumbar diagnostic. They are usually doing this for checking for meningitis. This is a diagnostic to diagnose the patient. That'll be important to remember. 62272 is the same thing, but it's therapeutic for drainage of cerebrospinal fluid. So the difference in 62270 and 62272 is one is treating the patient and one is diagnosing the patient. 62273 is an injection in the epidural space of blood or clot patch. What they're doing in this procedure is creating a clot for CSV leaks. They do this by injecting blood that clots. I have a note next to this that says blood patch, because normally that's what it's called in the operative reports. Some other common procedures are listed below. And 62280 is injection or infusion of neurolytic substance such as alcohol, phenol, iced saline solutions with or without other therapeutic substance, and it is coded by the body area. 62290 is for an injection for a discography. That is when they are performing a radiological exam on a patient, but they have to inject first. 62320 is another common code series that is used by pain management practices. These are typically called pain blocks. This is 62320 is an injection of a diagnostic or therapeutic substance with a needle or catheter into the epidural space. 62320 is for the cervical or thoracic region of the spine, so the neck and the mid-back. 62320 is without imaging. If imaging such as fluoroscopy or CT was used, you would code 62321 for the cervical and thoracic region. These are typically done in the lumbar region, which is 62322. The same exact procedure, but in the lumbar or sacral region of the spine, which is your low back. 62322 is without imaging guidance, and 62323 is with imaging guidance. 62326 is an epidural injection, but it also includes an indwelling catheter placement. These aren't seen as often as the 62320 through 62323 series. Now let's talk about the reservoir and pump implantation. Pumps are sometimes implanted for patients with cancer or who are getting chemo. 62360 is for the implantation or replacement of a device for intrathecal or epidural drug infusion. 62360 is for the subcutaneous, so that fat layer of your skin, reservoir. If it was a non-programmable pump, you will use 62361. If it was a programmable pump, including preparation of pump with or without programming, it's 62362. For the removal of the subcutaneous reservoir or pump previously implanted, it's 62365. Now let's go to the posterior extradural laminotomy or laminectomy for exploration, decompression of neural elements or excision of herniated discs. Let's look at the definitions. Percutaneous is image-guided procedures such as computer tomography, CT, or fluoroscopy performed with indirect visualization of the spine without the use of any device that allows visualization through the surgical incision. Endoscopic means spinal procedures performed with continuous direct visualization of the spine through an endoscope. Open refers to spinal procedures performed with continuous direct visualization of the spine through a surgical opening. Indirect visualization is image-guided, so CT or fluoroscopy, not light-based visualization. Direct visualization is light-based, and it can be performed by eye or with surgical loupes, microscope, or endoscope. Now let's look at the codes. 63001 through 63011 is for a laminectomy with exploration and or decompression of the spinal cord without a fascectomy, forenotomy, or discectomy, one or two vertebral segments. Now, this is important to know that it's without a fascectomy, forenotomy, or discectomy because normally those are done with the laminectomy. There will be another code range that includes those that we'll go over in a second. This first code is for the cervical region. The indented codes underneath it are for the thoracic, lumbar, and sacral regions. These procedures are normally done for spinal stenosis. So when you see that diagnosis with a laminectomy, you're typically going to go to this code range or the code range that includes the fascectomy, forenotomy, and discectomy. It's important to know what a vertebral segment is. A vertebral segment is two vertebrae. So if it says L1 to L2, that is one segment. Now let's look at the code range that includes the forenotomy, fascectomy, and excision of a herniated disc. Look at 63020. This is a laminectomy, but it's a hemilaminectomy. So that means hemi means partial, without decompression of a nerve root, including partial fascectomy, forenotomy, and or excision of a herniated disc. When a laminotomy or laminectomy is done for a herniated disc, you're most likely going to be coding from this code range. 63020 is for one inner space, so in between two vertebral segments. So if it says L1, L2, that's one inner space. 63030 is for the lumbar spine. 63035 is each additional inner space, so this is for the cervical or lumbar. So if they did an L1 to L2 and an L2 to L3, you would code the first code with this code as an add-on code. Six 63040 is the same thing, but it's a re-exploration. So they're redoing it. They will have to specify that it's a re-exploration. Now let's look at transpedicular or costovertebral approach for posterior extradural exploration or decompression. 63055 is a transpedicular approach. They must say that that was the approach that they used to decompress the spinal cord. This code is for the thoracic region. 63056 is for the lumbar region, and each additional segment of the thoracic or lumbar will be coded with an add-on code 63057. Now let's look at the corpectomy codes. I have these bracketed by approach because you must look at the approach used when the corpectomy is done. 63081 and 63082 are the anterior approach. 63085 and 63086 are the transthoracic approach. 63087 and 63088 are the thoracolumbar approach. 63090 and 63091 are the transperitoneal or retroperitoneal approach. Now we're going to look at the nerve block section. These are nerve blocks and the injections of anesthetic agents. Don't get these confused with a neurologic or chemodenervation. The first series is the somatic nerves. If an injection is done into a somatic nerve, it is one code. You just need to pick the nerve that was injected. 64400 is injection, anesthetic agent, tegmental nerve, any division or branch. And then underneath it, you have all the other nerves, the facial nerve, greater occipital nerve, vagus nerve, phrenic nerve, and so on. It goes all the way through the next page until you get to code 74479. 64479 is injection of an anesthetic agent or steroid transforamental. That's important. These are called transforamental injections. It's injected into the epidural space. Transforamental is the approach they are using. This code includes imaging guidance, and it's for the cervical or thoracic region, single level. For example, if they were to inject the C1 to C2 and the C2 to C3, that would be 64479, and the additional segment would be coded with 64480. If it were the lumbar or sacral region, you would code 64483. These are commonly done on the lumbar and thoracic region. 64484 is the add-on code for the lumbar or sacral region. Another common pain block that is done in pain management clinics is the facet injection. I have these bracketed in facet injection category. 64490 is for the cervical or thoracic region, single level. The second level should be coded with 64491. And third and any additional levels should be coded with 64492. Because 64492 says third and any additional, you will only code 64492 one time. Even if 5 segments were done, there would only be 3 codes coded. 64490 for the first, 64491 for the second, and 64492 for the third, fourth, and fifth. 64493 is the same thing, but for the lumbar or sacral region. 64494 is for the second level of the lumbar and sacral region. And 64495 on the next page is for the third and additional levels of the lumbar sacral region. You have autonomic nerves and those injections listed here. Then you have your peripheral nerve neurostimulator section. Just like with any neurostimulator section, you have codes for percutaneous implantation, codes for incision and implantation, revision or replacement, and removal. Then let's go to the destruction by neurologic agent. This was the section I said don't get confused with the injection section. These are destruction codes by chemodenervation. Let's look at some common ones. One is 64620, which is the destruction by a neurologic agent, intercostal nerve. Then you have 64633, destruction by neurologic agent, paravertebral facet. So these are the facet destructions. The same thing applies with the cervical as does the lumbar. 64633 is for the single facet joint. 64634 is for the each additional joint, cervical or thoracic. Then you have 64635 for lumbar or sacral. and the add-on code for each additional 64636. Let's look at the neuroplasty section. A neuroplasty is the surgical decompression or freeing of an intact nerve from scar tissue, including external neurolysis and or transposition to repair or restore the nerve. 64702 is a neuroplasty digital, so your fingers or your toes, one or both, same digit. Indented underneath it is 64704, which is for the nerve of the hand or foot. These are coded by region and approach. A very common one is the neuroplasty and transposition of cranial nerve, ulnar nerve at the elbow, ulnar nerve at the wrist, and the median nerve. It's important to know that the medial nerve is a carpal tunnel release. That's what this procedure is called. It's important that you write this next to that code. When they are doing a carpal tunnel release, they are releasing the median nerve. And on the last page is the neurography or repair of a nerve section. These are coded by length and by nerve. Look at 64910 for nerve repair with synthetic conduit or vein allograft. Each nerve. Because that code has each nerve, that means that code can be coded for each nerve that is done. So if there are 3 nerves, that code would be 64910 times 3.